Performing surgeries when I was pregnant was rough. This is me when I was pregnant with my son, and this is at 38 weeks, and I operated until about 39 weeks. I was 34 when I was pregnant with my son. It was my first pregnancy, so I didn't really know what to expect, but yeah, standing close to the table with a big belly like that definitely had its challenges in doing spine surgery. I didn't really limit the amount of cases that I did until I was in my third trimester, and then I definitely started operating like half days and picking less challenging cases. I think for the most part, patients really understood, and if there was something that they needed that was more complex, I'd ask my partners for help or just have them do that surgery, or they could wait until after my pregnancy. Surgeries that I perform are usually ones that are more elective, so waiting a few weeks until I came back from maternity leave really wasn't that big of a deal to a lot of my patients that really wanted me to do their surgery. I took 6 weeks of maternity leave with my son, which honestly, in hindsight's 2020, I don't think was enough time. But with the way modern medicine is, I am in private practice, so the longer I was out of work, the longer I was out without pay. This is my second pregnancy with my daughter, and I was 39 years old when I was pregnant with her. This pregnancy for me was a little bit tougher because not only was I older, but I did have a lot of SI joint pain with her and pretty bad carpal tunnel as well. Luckily, I had a partner in crime because my PA Erica and I were actually pregnant at the same time. She was 3 months behind me, so we staggered our maternity leave, so she was able to cover the practice towards the end of her pregnancy when I was out on maternity leave, and vice versa. I only took 4 weeks of maternity leave with my daughter. I really think that I envy those women that can do longer maternity leave, because for me, it was just not financially feasible to do that. But we survived. All my partners, who are all men, by the way, during both pregnancies and postpartum window, took all the call I needed and definitely did not make me feel pressure to come back to call too soon. So I was really, really grateful for that. I wish that there was like a good time to be pregnant and have a surgical career, but I just don't think that that time exists. I just feel very fortunate to not have had any complications with my pregnancy and to have 2 healthy kids.